Welcome everybody to In the Interim. In the Interim is a program that we've put together here at the University of Michigan College of Pharmacy to help pharmacy students and faculty and staff interface and network with leaders of pharmacy throughout the United States. My name is Bruce Mueller and I am the Interim Dean at the College of Pharmacy at the University of Michigan. When I put together the program In the Interim and was trying to think of who would be really neat guests and important people for our students to be able to network with, Miriam Mobley Smith's name came right to the top. And sort of in a humorous way, she and I are the only two interim deans in the United States. I thought, how can we not have the program In the Interim without having interim deans? She's also got Michigan connections that we'll talk about in a minute. She serves as interim dean at Northeastern University College of Health Sciences School of Pharmacy. And something new for In the Interim for this particular episode is that we have invited guests from Northeastern University to participate as well. So welcome to all of you and welcome to all our Michigan folks. And with that, I'd like to welcome Dean Mobley Smith. Thanks for joining the program.
Well, thank you so very much. I'm so happy to be here, and I really feel very honored to be asked to participate.
Oh, well, listen, so the program, the way it starts is we ask about what the heck is that picture behind you? Because my picture is simply my living room here and my little red sign that says that we are on the air that my daughter bought for me. But you've got a much cooler picture behind you. What's that all about?
Okay, what that is all about is last year, one of the several races that I have run, I came in third place in my age group in this particular one. And that's something I had never, ever done before. But in particular, because I took up running after a 40-year absence. So the last time I formally was running was when I was a pharmacy student at the University of Michigan. I lived out on North Campus, and there was this man-made lake out there that I used to run around. And so I gave it up. I had kids, I had weight gain, I had all kinds of things. So this is me, literally 110 pounds lighter and rediscovering better health and well-being. And I always tell people my area of practice and research has been with older adults. And it's nothing like the best classroom in the world is at the feet of an older person, or we call it now an adult of over the older lifespan or age span. But when I used to interact with them and have presentations and programs and those things, they're like, well, Miriam, you give us all kinds of things we need to do. You tell us about it. Your information is wonderful, but what's wrong with you? Why don't you take your own advice? And you can't come back from anything like that. I mean, you really can't. And you think about your genes and what you think is in front of you. And it's like, I need to shut this down. And so I rediscovered life, as I'll call it, and eating better, exercising, lifting weights, running, swimming. And so literally 40 years later, here I am winning races.
Well, it's amazing. I'm sitting here gaining weight because my refrigerator is just, 15 feet away, and it's hard to really, force yourself to get out and do that. So you talked a little bit, you lost a whole person. You lost 110 pounds for crying out loud. That's amazing.
Yeah.
Not everybody knows your background, but you got your bachelor's in pharmacy at the University of Michigan. And then in those days, you could do a residency right after that. You did. And then you went to get your PharmD.
Right.
And then you've held about 12,000 different jobs from what I can tell. So this person who grows up in Ecorse, Michigan, starts doing a whole lot of different things. And, it's your story to tell. And I don't want to spend all of it on your history, but kind of walk us through some of these things and some of the decisions that you made to get to where you are today.
Well, it ties back into passion, and I tell people you do follow your passion. And then, when you do, basically you won't feel like you worked a day in your life. And that's very, very true. But you never know how that passion can actually materialize. And so for me, in terms of pharmacy, it was all around a tragedy, really. My great aunt died from a medication misadventure. And it was one that absolutely was preventable. And so, being an individual that wants to make a difference, wants to make an impact, and really being in a position where no one that you ever encounter would have to die because of what happened, either someone's relative or not a relative. It was totally preventable. It was around ibuprofen of all things, Motrin, ibuprofen. She had issues in terms of multiple doctors she went to, multiple pharmacies. I mean, it was the perfect storm. And by the time it was all over with, she had double, triple dosed, had a major GI bleed, was hospitalized, ICU, heart attack, dead. And so not only did it propel me towards, helping to prevent those kinds of things, but actually to work with older adults, because at that time she was an older adult. When I was there at Michigan, I worked with previous professors there, Dr. Shemp and Dr. Bouvé, who were very much involved in geriatrics. And I was able to work with the Geriatric Institute. I did stuff with home remedies with them. It was just amazing. And so Michigan set me on that path, personally and professionally. And basically, yeah, the rest is history. So I left Michigan, worked in a major medical center in Chicago as a manager, was trying to decide when I was doing my residency which direction I wanted to go in. Thought it would be clinical, but it actually ended up being administrative. And so I followed an administrative path. I've been an administrator in health systems pharmacy. I've been an administrator in managed care pharmacy, and then ultimately, certainly an administrator in academic pharmacy. And so there were some other things all rolled in between, but research and teaching and all kinds of things tied into older adults. But along the way, and this is why, just because pharmacists maybe traditionally don't do certain things doesn't mean that you can't do it. And so I ended up an appointment with the Institute of Medicine on a committee for the Future Healthcare Workforce for Older Adults. I was chair of an advisory panel for the Center of Medicare and Medicaid Services in terms of the Affordable Care Act and CHIP and SHIP and Medicare and Medicaid, and we had been on conference calls with President Obama and Secretary Sebelius. And you just never know where your path may take you. And I know that sounded a little disjointed, because if I went through the whole thing, we don't have enough time for that. But but bottom line, it started with a passion that was evoked because of a life's adversity, but wanting to make a difference and then letting yourself follow where that path takes you. Not being detracted, not being deterred. People say you can't do it, you shouldn't do it, pharmacists don't do it. You're like, get out of my face. And then you keep on doing it, and then you end up with, well, me.
And there you are. So you've covered a lot of ground here, and I want to make sure that we give the audience the opportunity to ask questions. So you'll notice there's a chat function, and you can chat a question directly to me, or you can use the Q&A function, or I'm happy to unmute you toward the end of this presentation. You can ask your question live if you like. So I want to encourage you to think about what questions you might want to ask. Now, you and I have spoken before, and one of the things, so passion definitely comes through. The other thing that came through for me was that apparently you don't understand the word no, or pharmacists can't do something. And maybe you could tell us maybe an example or two of that, of how you didn't let somebody saying no or pharmacists can't do that to do what it is you really wanted to do.
Well, I guess a good example is probably my academic trajectory. And so I was a faculty member in the Department of Pharmacy Practice at 2, well now 3 institutions. And so traditionally a lot of the research is done in pharmacy practice. Now I'm separating that from pharmacy administration, okay? But in pharmacy practice, drug studies, those types of things. Well, basically I was a social behavioral pharmacist. And so I did survey work, I did a number of things because I was always wanting to know what the impact and the outcome of pharmacy services were. So providing drug information, providing medication counseling, and so on. And so it wasn't enough to do it. I wanted to see if we were really making a difference. And so I actually was one of the first pharmacists in the state of Illinois to get funding to do on the ground education, medication education, and developing clinics, healthcare related clinics in regional community centers in the Chicago area. We work with housing complexes, the Chicago Department of Housing. We work with Catholic Charities. We work with a number of different entities. And so it wasn't traditional, quote unquote, pharmacy practice work. Well, when I was submitting IRBs, Institutional Review Board approvals or submissions, well, you need to go to biomedical board, but they're probably not going to agree with what you're doing, you know, and I'm saying, no, I need social behavioral board because they will understand. And we're going back and forth about it. I was told you must do biomedical. And I said, eh. And I went to social behavior anyway. It got me in trouble, but I got it approved.
That's the right thing to do.
It was the right thing to do. And I call it being stuck in tradition and culture. And I mean, well, not culture, but tradition and not being innovative. Now, I've never been accused of not being innovative. And so there was one little example. I certainly could give more, but that one in terms of academic setting, if I would not have, if I would have followed them and my work would not have been recognized the way that it was, and I say mine, there were two other colleagues of mine that were working with me at that point, but nevertheless, it would not have led to several of these things that I just mentioned. And also recognitions by, you know, great cities, institute there in the Chicago area, and also to have a visit from the Assistant Secretary of Health and Human Services, the first Latina who was in that position, Josefina Carbonell, back at that time. We developed programs in various languages, actually 25 programs, 25 different languages. And so we had visitors from DC and so on coming. Who does this stuff, you know? So if I would
we really need to, I mean, we need to be doing more of that than ever. You were really way in the front. You were too far advanced.
You know, as I said, it caught the eye of the Institute of Medicine. Okay, so I feel really good. But it was because I didn't ask permission. We knew it needed to be done. There was a void there. We were the first ones, as I said, to work with social service agencies. We worked with the state Department of Aging. We did all those types of things. We taught the social service people how to deliver their services around Medicare Part D.
So how did you get this idea, though? So, I mean, it's a big problem. It's a big problem in Chicago. It's a big problem here in Southeast Michigan. I'm sure it's a big problem in Boston to reach folks who really need the help. Like what triggers? That's a heavy lift when I think about how big the problem is. A lot of people won't even attack the problem because it's such a big problem.
Well, I'll tie it back to, I think all of us at some point have heard of brown bag programs. And so even as a student intern way back when, we would go to a community center and people would bring a big old sack full of drugs. And so we'd open it up, put them on the table and say, oh my, why are you taking so many medicines? Yeah, and then we talk with them about the best use of them. But no one ever knew what happened after that, okay? Really didn't. And medication use is not only in the United States for people who are English speaking, it's for non-English or limited English speaking people. They have the same fears and concerns and so on as everybody else. And they're dying because of medication misadventures. So we're pharmacists. We're supposed to help prevent those kinds of things. And when you're out there enough in the public, you see what some of the deficiencies are. They used to call me the Oprah Winfrey of the pharmacy world because I would go all out with my microphone and, you know, so on and so forth. And here's a little trivia piece for all of you on there. I actually have been on Oprah Winfrey Show in a speaking position twice about adverse drug events in the community.
Have you really?
I have the tape at home.
Wow. Honestly, if I was ever on Oprah, that would be my background. It wouldn't be running in a race.
But it's on a VHS tape. It's on a VHS tape. I can't make that one come.
None of the students on this call even know what a VHS tape is. So there you go.
I know.
So, you know, we know you went into pharmacy because of, you know, the reason was this medical misadventure with your relative. And then you said passion. And I want to come back to that. What's the passion? I mean, what is it that has drove you then, drives you now?
When my time comes, when my maker calls me and says, Miriam, job well done, what do I want to be on my tombstone? She made a difference. Bottom line, I believe in paying it forward with the, to much whom is given, much is expected. And when I was there at Michigan back a few years ago with the Alumni Service Award, I spoke that same quote because it is our obligation and responsibility. When we've been blessed with these types of talents, we don't just keep them and hide them under a rock. It's our responsibilities to help make a difference out there. And that difference can be for our communities, for our patients, but also for our colleagues, for our students. I'm very student focused. I've had students, I've had in various levels of students. I've had residents, fellows, mentor fellow faculty members, other pharmacists, and so on. Again, all of us collectively making a difference for the good of mankind. When I was vice chair of the Board of Pharmacy in the state of Illinois, our role is to protect the health and well-being of the citizens of the state. And my colleagues who are on the Board of Pharmacy there in Michigan and other places, it's the same type of thing. We're given that responsibility of oversight to ensure it, particularly from a medication use perspective, that things don't happen that hurt, harm, or kill people. When I did a video for Blue Cross Blue Shield several years ago, and it was about older adults. It was called Senior Stories. And at one point, as we closed out the video, I said, you know, bottom line, good medicine can help, good medicine can cure, good medicine can hurt, but good medicine can also kill. And so it's our role and responsibility to help prevent those medication misadventures. In other words, we're about positive outcomes. And so making a difference, that's what it's all about. Paying it forward, that's what it's all about. And that's what I have been all about.
I was in a meeting today with our admissions officer, and you know, around the whole country, admissions to pharmacy schools or applications are down.
Mm-hmm.
And it's making me crazy because of the things that you said. You can make such a difference. You can be on the front line. COVID, you know, who do you think is going to vaccinate America? It's going to be the pharmacists. But I don't think it's coming across to high school kids or, you know, sophomores in college that you can make a huge difference as a pharmacist. I'm not sure how we get that message out.
You know, it starts internally. And maybe this is I'm going to be on a little platform here now, okay?
I'm ready. I'm ready.
When I start talking about us, all right? We need to be innovative and break outside of the box, okay? Break out of the mold for traditional practice, build on experiences, don't limit ourselves. When we think traditionally, but we expect different outcomes, that's insanity, okay? It really, really is. So as we develop the passion for the profession and the patients we serve and all the different ways we can do it, I mean, quite frankly, there's still over 170 different things that you can do with a pharmacy degree. Now, obviously, some of it you have to get additional training and education and so on. But, you know, at the end of the day, there is a lot that can be done. Now, don't get me wrong. It's appropriate and passion in community settings, hospital settings, and so on. You know, again, your more traditional practice. We need good clinicians in those areas. So never, as a student, let anybody tell you, oh, you shouldn't be a community pharmacist or community practice pharmacist. Oh, you shouldn't do this, because we need good people in those positions. But on top of it, there's a whole lot more that can be done as well. And so I guess that ties back into the, you know, if you're a pharmacist, you do this. Well, no, not necessarily. You let traditional practice be, but you search for creative and new approaches to existing problems, okay? It's really, really important. Find that purpose. When you do it, it will help direct you to where you need to go. And so it's that passion, that story that will help others understand why pharmacy is a good profession. It's been really good to me. It's been good to just about everybody I know, with some exception, the people who want to stay stuck doing it the same way all the time. People have to realize that actually in the areas out across the United States, especially in the rural areas, the doctors were the pharmacists, okay? There was not enough bandwidth for the community docs out there to take care of all the patients. In fact, they call the pharmacist doc. We come by it naturally. And so it's exciting, but we got to start earlier too. We can't wait till people are in high school to talk with them about pharmacy. We used to go back in the day into like the elementary schools to talk about poison prevention.
Right.
helping people understand the important role of that. Again, what are we doing? Preventing people from dying from poisonings. And so with the Mr. Yuck stickers and all of that, we would go in. That was so much fun. In fact, I embedded it in a course, in a college level course where
Mr. Yuck.
the students would go into the schools and talk about those things.
That's a good
But
idea.
yeah, it was really a lot of fun. But but to answer the question though, we have to have passion about the profession so that we can excite others about it. And unfortunately, some of us are stuck in the wrong way. I hopefully there you weeded out in like preceptors, any of those preceptors that are down on the profession, because that's not what we want. So the people who are down on the profession, they need to like be assimilated out. All right, retire, do whatever they need to do. Get out
surround
of
yourself
our way.
surround yourself with positive energy. That's
Okay,
absolutely.
we got to do it. We want our students around positive energy. This is
Well,
so really important.
I'll tell you what, the questions are rolling in, and audience, as you've got them, I'm going to just try to translate these as fast as I can into what we're talking about here. So we have a lot of students on this call, and one of the students asks, they're at a spot in their careers of trying to figure out what it is they want to do. And you say there's all these things, but how can they think about it? So I kind of want you to answer that. I also want you to answer if somebody wants to be active in the working with the community in a way that you were.
Mhm.
What do you think's the path?
Okay.
Two different kind of questions, I guess.
I know, and I'll try and give short answers. Sometimes short answers, I don't know how to do that. But anyway, the short answer, you have a wealth of information and resources at your school, meaning your faculty members. Your faculty members are unique individuals. They have all kinds of experiences and they can hook you up. They can be your mentors, but they can hook you up with community individuals who you can learn at their feet more and more about what goes on. The community center piece, I mean, who would think about, working with social service agencies? You can go volunteer and find out what's going on there, creating those niches. And for those students who are going into their fourth year in your ACPEs, don't just select those things that everybody else selects. Challenge yourself, stretch your thoughts. I'm going to tell you, back when I was an experiential director, at one point along that journey,
One of the 12,000 jobs you've had.
one of the things that used to tickle me the most was students would be all upset because their rotation got canceled. Because something happened, about, honestly, the straight of it is about 10% of the rotations get canceled every year. Because people move, preceptors move, people get pregnant, have babies, they get sick, all kind of stuff, relocations. And I ended up having to reassign some people to some areas that they would not pick. Like, oh, Dr. Mobley Smith, why would you do that to me? You're just doing this, blah, blah, blah. And I'm telling you, they'd get into an area they never thought they would be interested in. Next thing you know, not only did they finish the program, went on, did postdocs and this, that, and the other, then they became researchers in that area. They come back and say, Dr. Mobley Smith, that's the best thing you could have done, was allow me to make me actually stretch my roots. And so, and stretch my horizons. But bottom line is there are a number of individuals there right at your schools for people who are here listening from Northeastern and for there in Michigan. Tap those resources, okay? Volunteer to do things. Volunteering doesn't take that much time, but it'll open your eyes to things that you never understood. One of the things I did when the pandemic started, I delivered meals to shut-ins and isolated seniors in the community. I had 24 different households that I was responsible for because pretty much everything else I was doing was shut down. I was working at the time for the accrediting body for colleges and schools of pharmacy as an evaluation consultant. And I said, I can make an impact out there. My kids were concerned. They're like, Ma, you fall in that vulnerable population. Are you sure you want to do this? I said, yes, I do. I'm gonna do it in a socially distanced way. It was so rewarding. I have told people, you need to do those things. As you're in the older, if you deal with geriatrics, get out there where they are to find out what's going on. People who have had double amputations, people who are living in different types of economic conditions, you see what they need and it tells you what to do. So look in non-traditional ways for things that you feel might ignite your passion. Don't limit yourself. The opportunities are there.
All right, so now that you've had all these jobs, I'm getting a question. One of them wants you to because you've had all these jobs, you know more than anybody else in pharmacy what's going on. And somebody wants you to look into the crystal ball. What do you see coming ahead? What would be a really neat niche that maybe our students aren't thinking about so much now, that is something that you see would be a really cool place to work where you can make a difference? And there's going to be jobs, because I think we need to make sure there's jobs in it. Or you got to make a job, even if they say there's not a job.
So let me tie it back to the federal government. Then there's a few of these jobs now, but it's going to be blowing up in the future. When you think about quality measures and incentivized payments, physician practice groups, accountable care organizations, so on and so forth, they need pharmacists as a part of their interprofessional teams. More and more research is coming out right now about the value of pharmacists on these teams in terms of meeting outcomes. And there's a lot of payment. Now, I learned this when I was working with CMS and being chair of the advisory panel for 6 years. And so even though it may not have the word pharmacist or the term or the classification pharmacist all over it, we have the ability to have the greatest impact in that area. And so pharmacists that I know that are working in those areas are helping medical centers, helping ambulatory care centers. I'm chair of the board of FQHC. I don't know if you're familiar with that term, Federally Qualified Health Centers, the largest network in the state of Illinois. See, I don't know how to stop. I'm the Energizer Bunny. It's ridiculous. But nevertheless, pharmacists are embedded in those practice settings, and they help us meet those measures, actually exceed them. And so incentivized payments come in, and you do risk share agreements. In other words, you could even run your own business and have contracts, consulting contracts with these entities and be doing fine very well.
So for the students on this call who want to follow that kind of path, what do they do to try to take a rotations, maybe in managed care or some area? And then what about after, what do they do after that? Is there a residency path, or what's the
pretty
path?
much, you need to do that, or you can do fellowships or something in that particular realm, so that, or even go back to school and think about a master's degree in public health or in areas such as that, so that you can get a better understanding of the healthcare system. And not only the US system, but also dovetail into the international system. One of the problems that I've had, I make a lot of suggestions to colleges and schools of pharmacy about broadening your healthcare systems courses to incorporate a better understanding like that. So my work with the Institute of Medicine, you can't walk in there wearing a hat of the pharmacist. You walk in wearing a hat of a healthcare professional policy analyst. So more work in policy. Understand that initiatives that come out of Washington, who you talk to about what. The legislators make the rules, the agencies operationalize them. And so understanding the difference between that and how to be able to get that background and go to them and talk about the things you need to. But it's that same understanding that helps you be successful in these FQHCs and other community health center type of environments.
Well, I'm going to put in a plug for everybody who's from Michigan. We've got a PharmD MPH. We've got that degree program. If that's something you're interested in,
and we do too.
Come see me. And you do too. So there you go.
That's right.
Get in on it if you want to do this. It wouldn't be the late October if I didn't ask you one of the questions that just came across, and that is, we got an election coming.
Oh, no.
It can't get over fast enough from my perspective, so my phone stops ringing. Is it going to make a difference in what's going to happen, and in even maybe the careers you just talked about? I mean, are those people going to be needed, pharmacists needing those roles just no matter who gets elected?
Yeah, the train is out of the depot, okay? This is, regardless of what happens to the Affordable Care Act and any other kind of political whatevers, the train is out of the depot. And so it's not going to go backwards in terms of fee service. It's going to continue on that pathway of value-based payments. And so, yes, the opportunities are there, but we have to create opportunities too. And we have to recognize when they're there and not shy away and ask for permission. One of the things that I thought was kind of interesting, we put a lot of emphasis on trying to become providers under Medicare Part B, but really a lot of the emphasis, and that was national, but a lot of the emphasis is local. So, you know, when the state started providing pharmacists or allowing pharmacists to be able to bill for services and so on, that was a state driven thing. So you learn nationally, act locally, and the two find their way in together. And so I see some questions
There's
though
a lot of questions in here.
in the chat. And we
Yeah.
talked about the pharmacy, my passion, alter traditional practices. Okay, where the advancements, I just mentioned that. What do I enjoy the most about being dean? Honestly, it's back to that impact again, because of what you can impact, the broad impact. The strategies themselves can impact countless individuals directly and indirectly. Directly because of the students and the fellows and the residents, indirectly because of the patients they're going to serve in the future. And so in terms of leadership in these kinds of positions, you know, you get here, you have to learn how to delegate and do a number of things because you don't have enough hours in the day to be able to do all the stuff you need. You need a good team around you. And most of the time you get to a position like this because you learn how to do it yourself really well, because then all of a sudden you became a leader and so
And they
on.
promote you,
I
right?
know they promote you to a whole lot more.
Till something you're not good at, right? Isn't that the Peter principle?
But the bottom line is it's the infrastructure, okay? So I used to be the doer, on the ground doer. As time went on, I'm now in a position to create the environment and the infrastructure for success. It gives me the most pleasure to watch my colleagues be able to do the research they want to do, to be as successful as they are. I go out there and find money, okay? I find other things to help shore it all up. I deal with the politics. Back in Illinois, they used to know me as the woman with 3 names, okay? Because I'd always be down there saying, where's my money? But anyway, creating the environment for success. I love that. I love it. You know, I'm involved with strategic execution of various types of plans. I deal with the various challenges and such, maintaining operations, keeping tabs on my competitive environment, you know, and your dean has to do those kinds of things too, because there's the reality of it all. But at the end of the day, we provide the opportunity for people to be successful.
But I got a question here. It says, and I'll just read it. What's it like being a dean from a woman's perspective? And are there any unique challenges?
Okay. So let me put it this way, and this will probably sum it up. Never mistake kindness for weakness. Does that help?
I'm not sure how to take that, to be honest. But
Well, when I have been driven, and I'm a driven person, if you can't tell that, okay?
figured it out.
So when I've been most driven, I have been in a situation where I was called aggressive. But if I looked at my male counterparts, when they were driven the same way I was, they were like, oh, they know what they're doing. You know, they have some foresight. They have this and that. Yet I'm aggressive, or I'm a word that I won't say, you know, that rhymes with other words. So that's not the case. But I'll tell you, being a woman and using all the skills that we have to use over our lifetime as an individual, as a caregiver, as a parent, as a wife, if that's what you end up being, or whatever kind of partnership you're in, we have an ability in many cases, I'm gonna generalize right now, to use all those skills in our toolbox and have a really good understanding of when certain tools should come out of that toolbox. People have told me that I'm pretty good at that, and I love that, you know. But no, in terms of women, people look at you as a woman first, and I'll go one step further as a woman of color. Okay, so I've had challenges about that too, and I don't know which one of the challenges have been worse: the person of color or the woman. And actually, one time it was twice. Because when I was actually graduating from Michigan, getting ready to embark on all kinds of things, I was working as a technician at a community hospital there. And just about to take my boards, I'm all happy. And one of the people there says, well, Miriam, we really like you a lot, but as long as I'm here, there will never be a Black pharmacist, much less a Black woman pharmacist, ever working in this facility. And so, you know, I could have just said, oh my God, why did I spend all this time and effort to become a pharmacist if this is what time it is? But no, see, for people like me, all I get is, you know, righteous indignation. It's like, I'm gonna show you. And so I haven't actually seen that person. There's a backstory too about that. I did see the person somewhere later, and I was a manager and they came and applied for a job. It's like, not today. Okay. But
Paybacks are heck.
you know, it really is. But anyway, a lot of it is, I said, been around the perception and so on. One other challenge, and this is not when I was a dean, but dealing with a woman. It was a challenge when part of the time when I was childbearing, and actually I'm going to talk about this Monday at that session that, you know, I told you about, Bruce.
Right, right.
I wanted to work part-time a little bit to take care of some kids for a while. I mean, you know, at that time it was women's lib, it was the glass ceiling, all of those discussions were going on. And I made a decision, you know, and once you make a decision, you have to live with it. I was already an administrator, but I wanted to step back a little bit. And I was told I could not be an effective administrator working part-time. And I'm like, why not? Because you're a woman and you have kids. Okay. All right. So here again, you know, you asked me about saying no or asking permission or being driven. See, when people put roadblocks in front of me, all that was propelling me to even more greatness, because that's the way I feel about it. I'll show you. And so the rest is history. And am I not? I have 3 grown children. I have 5 grandchildren. I don't think, you know, being a part-time administrator stopped me from what I was going to do.
Yeah, you seem to do okay. So there's a question here that talks about, but work-life balance. You are this driven person, raised a family, all these things, and there's 24 hours in a day. And
yeah.
Talk to the audience about this, because this is, I think this enters into what career do you want to go into? Do I have to sacrifice this if I want to go in this particular area? What would you say to the audience?
So there's a difference between work-life balance and work-life integration. I've actually stopped using the term work-life balance because I don't even know what that is, all right? I mean, quite frankly, integration is, you make a decision about the things you need to do and you look at how you can integrate that in. But understanding that life is a journey, it's not a destination, because the destination means once you get there, it's over. It's a journey. And on that journey, you need to make adjustments. And you have to decide what those adjustments are worth to you. And so nobody does it all the same way. But whatever decisions you make, you live with them. But you always have that goal in mind. You know where you're going, how the decisions you've made at this point fit into that goal, and you follow it. That doesn't mean you're always going to be on the same path. It's going to twist and turn a little bit. I look at it as a chess game. You know, you go check, check, check. It's not over till it's checkmate. And checkmate is when you're not here anymore. So I don't worry about that, because that'll take care of itself. But in terms of the checks, every time you get a check, what do? Pivot. All right. And I'll tell you, the greatest pivot in the world right now is this pandemic. Whoever would have thunk it, as my kids say, that this kind of stuff would be going on. Silly me, I'm gonna change jobs, going to a big old job in a whole nother place in the middle of a pandemic. You know, what's wrong with me? But
you and I are not bright. We both took deanships knowing what the heck was coming.
Okay. But here again, it's still the same thing. It's integration, because I'm doing a whole lot of things still at this point. I don't have small children, but when I had small children, I had to make decisions. Part of it was that, you know, working part-time. Some people would say, oh, you don't want to, you know, lose traction in your administrative career. Why would you do that? It was a choice. I had to live with it. Once I made the choice, I didn't look back. I said, okay, I'm comfortable with the choice. I actually went back to school when I had 3 young children, all right? So I'm going to use the time. I'm helping to rear them. I'm working part-time, but I'm also developing and enriching my ability so that when I'm ready to hit back on that trajectory, I'm firing on all cylinders. So that becomes a part of that collective thought and that planning. And it kind of comes down to developing a business plan around your ideas, but your life and your career. So a business plan, okay?
Yeah, you got to live your values. You make your decision, you live with them, you just keep getting better. And as you said, go get your degree, and it was great. I know we're way over time, but if there's any last questions from the audience, I'd be happy. We can raise your hand and ask, or you can type it in. I'm going to make sure I cover everything that should be covered here. I think we got most things so far.
Okay. Also have a good sense of humor. You probably can tell I laugh a lot. And also you need to do self-reflection. That's really important as well.
Well, here's a question that just came up. So you laugh a lot, you enjoy your job, you enjoy the challenges. Is there anything you don't like about your job? That's one of the questions. See, she laughs a lot.
My girlfriend, unfortunately, who passed back in April from metastatic breast cancer, had a term that she would use all the time. And I don't know what it means, but I think it's funny. I said, isn't it something to work with people when they act crazy as a bitty bug? What it is that I don't enjoy is grown people acting worse than my kids, all right? And you got common sense, you're smart. You're in these positions because you're smart, okay? You're a researcher, you're this, you're that, and the other. But these decisions that you make sometimes and the direction that you go in and so on, like, what's up with that? And it's like, no, if it takes more energy out of me than it took for me to raise my kids, something wrong with this picture. And so that's the thing. And so sometimes, you know, we have to, let's say, take directions as administrators that cause folk a little angst, but it's because they're not being mature in the way that they handle themselves personally and professionally. So that are the things that take up way too much time that don't need to. We need to have positive energy so that we can move the tide, raise the tide, lift the boats, and all of that. We don't need all of that other, right?
One of the takeaways I got from you too is that you went out and volunteered in this pandemic. And I know we have some students who are struggling, just are in a funk on their own because we really miss this social interaction and so forth. I really love this idea. So go help somebody.
Right.
Get out of your house and go help somebody. I think I always find that's like the best thing you can do.
It helps you forget about any troubles. I'm telling you, when you're challenged with stuff, there are people out there that have a whole lot more challenges than you do. And when you're there assisting them, it kind of melts away some of your issues. And when you do a comparative analysis, it's like, whoa, okay. And it does, it warms your heart when you can help someone, when you see that the struggles that they have, that you've been able to impact it in a very positive way. And it makes all the difference in the world. And, you know, that's probably a good way to do the full circle thing. Go out there, be creative, make the impact that I know that all of you can make, and, you know, keep on making it. And that's the bottom line.
That's a good place for us to end, I think. Dean Mobley Smith, so happy to have you on here. I think you inspired all of us. Got me all revved up. Maybe I'll do a little more work tonight. I don't know.
Oh, run.
Thanks for being on, and thanks for everybody to be on the out in the audience. I want to tell you all that I'm not going to have this program next week. It's election week. I want you to vote rather than worry about coming to one of our programs. But we are going to then on Monday, November 9th, our next guest is going to be Audrey Nakamura. Audrey's a graduate of the College of Pharmacy. In the early 2000s. She is in California. She's at UCLA, where she's running much of the hospital at the Ronald Reagan Hospital there in California. So students who are interested in hospital practice, administrative practice, or moving back to California, and I know we have a few of those as well, I would definitely tell you that you should listen to what Audrey's got to say. She's another person with a lot of energy. So thank you again, Dean Smith, and thanks to the audience, and I'll see you all on Monday, November 9th.
Bye, everybody.
Thank you.